Well, welcome back to Vet Talk with Dr. Sarah Goldsmid from the Animal Referral Hospital. Don't forget you can check us out in the iTunes store, or you can watch this little video. What do they call it? A vodcast? Video on demand cast?
Could be, or a podcast with pictures.
You can watch that on
Do you get vodka when you in a podcast?
You can watch that on VETtalktv.com. That's the one. She's throwing me off now with the vodka line.
We could have Vet Talk parties.
We could.
I like it. Speaking of parties,
no.
what do you do at parties or dinner parties when people say, "What do you do?" Do you tell them?
Yes, I do normally tell them, and then I often get a bombardment of questions about their pet.
Yeah.
So they'll say, my Fluffy's had runny poos for the last 3 days. What do I do? And I go, I'm a surgeon, sorry, I can't deal with that.
I don't know anything about that stuff.
I am actually limited in my answers because they'll ask me, what's the best flea treatment? I go, well, I don't know. Yeah. I'd have to ask somebody in retail or medicine about that, or my dermatologist will know.
Yeah. I've seen your own dogs in here. So
I do have to ask somebody what the best vaccine for my pet is now and how often I should vaccinate, because I don't do that regularly. That's not my day-to-day work. So,
but when it comes to Christmas, probably you get the job of cutting up the turkey.
And I have to sew it up again afterwards.
Speaking of sewing, I've seen you sew.
Yes.
You do it with your eyes closed and talking to camera. It's like...
I usually keep my eyes open, but...
You must be very good at darning socks.
I love sewing. Like, when I grew up, I was very much into creating crafts, and sewing, cross-stitch was popular.
Well, it's paid off.
I think you have to have a kind of three-dimensional mind to be a surgeon, particularly. It's a different kind of skill set to some of the other specialties, and thinking three-dimensionally, being good at puzzles. When I have a skin wound that I've got to close, and it's got to come together, and you've got to think, well, what happens if I lift this bit of skin and move it here? How will that affect the other skin? How is it going to suture closed? You do have to have that sort of mind of creative three-dimensional thinking. I think probably similar to like architects or design people. It's very similar. It's quite artistic to be a surgeon in my mind. And so I think having those sort of skills and dexterous with your hands, I guess.
Terrific.
Alrighty.
Let's take a little break and we'll come back with more of Vet Talk TV shortly.
Thank you.